Factory shutdown in China is causing issues in hospitals half a world away here in Arkansas. THV 11's Mercedes McKay shows us why a nationwide shortage is putting certain medical tests on hold.
It's called contrast dye. Basically, it's what hospitals use for CT scans to better detect things like heart problems or cancer. Now, while hospitals here in Arkansas are feeling the impact of this shortage, they're figuring out ways to adjust. Scanning the radiology room at CHI St. Vincent, it's hard to miss the big white machine. And true to its size, it carries a lot of weight in the hospital.
Diagnostic studies called CAT scans or computerized tomography really give us a very good picture of what's going on inside the body.
Chief Medical Officer Dr. Jerry Jones says sometimes doctors need that picture to be even more detailed, and that's where contrast dye comes into play. But right now, it's hard to come by.
The shortage of this IV contrast is requiring us to be more thoughtful in how we use a resource that before seemed unlimited and now we know is indeed limited.
Being more thoughtful at the hospital means prioritizing exams that are most important, like trauma patients, using different tests like MRI or ultrasounds, and if it's just a routine exam, it may get postponed. Over at UAMS, Chief Clinical Officer Dr. Michelle Krause says it's the same story.
Things that just are more routine or surveillance, we're trying to kind of spread them out in the schedule so that we can take care of things that are more urgently needed.
Over the past 10 days, Dr. Krause says they've really noticed the shortage's impact on their day-to-day operations. She believes the temporary shutdown reduced their supply by 75 to 80%.
We're just making sure that we're smart about who we're giving it to, probably for the next handful of weeks.
But if the pandemic taught these hospitals anything, it's that they'll get through this.
It is the world that we live in.
We will overcome, you know what I mean? We've learned to be very resilient, so we'll be fine.
In Little Rock, Mercedes McKay, THV 11 News.
Mercedes, thank you. That manufacturing facility that started this whole shortage is back up and running. Both doctors believe supply could be back to normal by the end of June.